Hampton.
Mr. Speaker, the Justice Minister has stated that she's open to decriminalizing all drugs. If it's not bad enough that thousands of Canadians are dying from the opioid crisis, which this Liberal government is not adequately addressing, now they want to add crack and heroin to the mix. There's not enough treatment centres as it is. Parents across the country deserve to know if the Prime Minister is serious about this absurd idea.
We are in a national public health crisis when it comes to the opioid crisis, and our government is treating this as a public health issue, not as a criminal one. We understand that stigma and barriers to treatment need to be reduced, and our government has taken initiatives to address this matter. While decriminalization would not ensure quality control for drugs, we have made it easier for health professionals to provide access to opioid substitution therapies and supported the Good Samaritan Act. Through Budget 2018, investments of $231 million has been made, and we will continue to develop innovative approaches to turn this tide on this national public health crisis. Thank you, Mr.
The honourable member for Bellechasse-les-Etchemins-Lévis. Mr. Speaker, the cat got out of the bag at the Liberal convention on the weekend. Marijuana hasn't even been legalized yet, and now the Liberals want to open up to cocaine, crack, and heroin. We already know the Minister of Labour and member for Beaches East York wanted to decriminalise all drugs, but now it's the official Liberal Party position. And yet Health Canada indicates these drugs are lethal. My question is simple. What kind of bad trip are the Liberals looking for? The Honourable Minister of Health. Thank you very much, Mr. Speaker. We're dealing with a national crisis. It's a public health crisis. And our government is determined to deal with the opioid crisis as a health issue, not a criminal issue. Stigma and obstacles to treatment have to be reduced, and we've undertaken a number of initiatives in that regard. And decriminalization will not guarantee drug quality, but we have provided professionals with access to opioid substitution therapies, and we will continue to take action to help avoid overdoses. Thank you.
Well, it looks like Liberals are open to decriminalizing heroin, cocaine, ecstasy, and other illicit drugs. Legalizing marijuana hasn't even passed. The Liberal plan to deal with the opioid crisis isn't working, yet here they are, the Justice Minister and this Prime Minister, unveiling their next big idea, being open to decriminalizing illegal drugs. Mr. Speaker, I ask the Justice Minister once again, is this really a path we want Canada to go down? And when did she get the mandate from Canadians to make illegal drugs legal?
The Honourable Minister of Health.
Mr. Speaker, unlike the Harper Conservatives, our government is treating this as a public health approach. Our government is committed to reducing necessary regulatory barriers to treatment. We are not looking to decriminalize or legalize any drugs aside from cannabis, and we will await further results about the impact of its legalization. With decriminalization, there would still be a risk of contamination.
Sorry, I have to ask the honourable member for Elgin, Middlesex, London, and others to wait their turn. Each side gets their turn, and we listen to the other whether we like what they say or not, and we get the turn when, in fact, the microphone is on and people can hear us back home. So we should each wait our turn, and we should listen to what others have to say, whether we like it or not. The Honourable Minister of Health has the floor.
Mr. Speaker, our government is proud that we're going to be launching a public education campaign to address stigma, reduce barriers for those seeking treatment, and we will continue to develop innovative approaches to turn this tide on the national public health crisis that our country is facing. Thank you, Mr. Speaker.
Honourable Member for Oakville North Burlington.